Okay. So, Harsha, am I audible in my screen time? Is it
Yes,
clear?
sir. Please go
Yeah,
ahead.
yes, sir.
Okay, fine. See, in a short notice, I got this presentation information, and I was told to share my views regarding the tips and tricks for presentation skills. Just a small intro regarding me. I'm Dr. Rajendran Dinesh Kumar. I'm an assistant professor at Rajrajeshwari Medical College, Bangalore, and I'm also a consultant at Trustwell Hospital, Bangalore. So, our presentation here today, why are we here today? It's just to discuss regarding the tips and tricks regarding presentation. For most of you, it may be the first time, or maybe they would have had an experience earlier where they would have gone to a conference and they would have presented a paper or a poster or case series. And usually these sessions are enthusiastically organized and also an enthusiastic group of participants, postgraduates, consultants. They do attend and they take valuable feedbacks and leave the conference. And this timeline presentation, it's regarding the start. How do we get an information regarding conference announcement, maybe from ENT, WhatsApp groups, and there's a call for submitting abstracts for poster, case reports, and case series. There's a deadline for these abstract submissions, and usually they give an option for whether you want to apply for a medal, which is a competitive session, or a free paper, which is a non-competitive session. And for postgraduates, they usually request for an enclosures where you get a bona fide certificate from your HODs and your institution. And you should also enclose your registration number for your conference. The usual assessment methods which any student should know when they prepare for any presentation is what is the quality of your presentation, the content, how is it relevant, and they have usually a time attack. For a case series, it's a different time, and a case report, it's a different time. And usually the judges are looking mainly for the presentation skills and the body language of the candidate who is presenting there. And usually this is followed by a question and answer session. So an abstract is a sample document which is usually presented to the scientific committee, and the outcomes are either it is accepted or rejected. More or less, I'll just share one of the sample abstract which I prepared when I was a consultant. So here in your screen, you can see how to write an abstract. Usually they have a structured abstract request, and usually that comes with a word limit. More or less, I would suggest you prepare one document like this. I will share it with Sriharsha. This soft copy can be used by any student in their future. So this is the state conference in Karnataka, which was organized in 2019 before COVID. And the abstract, what is the title of the abstract? What is the scientific session you are applying for? It should be very clear who is the presenting author. And if there are any co-authors, it has to be mentioned here. And what is your phone number contact in case if they want to contact you, and email ID contact. And usually the abstract usually starts with the background, what is the material methods, and if it's a case series, case report, it will differ. And what is the methods and materials, your aims and objectives, your results, your discussion and conclusion. Usually a keyword is also mentioned regarding your session, regarding your case report, and followed by that references. Some of the conferences don't expect this detailed amount of abstract submission, but wherever I've attended, more or less in the national and international conferences, they usually review this very critically before accepting your article. So the status can either be an outcome which could be accepted or they may reject it in case the topic is repeated multiple times. The usual presentation sessions are either competitive or non-competitive sessions. A case series where usually a student is expected to have their presentations done within 8 minutes with 2 minutes question and answer session, and case report of 10 slides, 4 minutes of talking and 2 minutes of question and answer session. Case series is usually a lot of descriptive or a meta-analysis or a retrospective study. So a lot of slides are usually added on to that. But a case, series is a little more number of slides, but a case series is a very minimal slides. Like you just need to summarize all your topic related contents in 10 minutes. Regarding free paper and non-competitive sessions, it is usually done by a group of colleagues who don't want to compete, and they want to present their topic with the audience who have a very interactive session. Not that a competitive session will not be interactive, but there are sessions where sometimes there is a limited number of slots available for competitive sessions. And if they don't fit in these slots, they may be on the basis of the scientific committee discussion, they may be shifted to the free paper session. But nonetheless, every session is of scientific importance. It cannot be ignored. There is always a take-home message for any session you attend. So if you have to write about a case report, I would suggest it in a very structured, structured method. So you should don't write in a heading like introduction, case report, what is the outcome, discussion, and end it. And then mention thank you in the end. It usually is a routine thing. So what I would like to students who are participating now is, suppose they have a topic which they are presenting as a case report. You just write a brief introduction background of what the topic is about. Then you present your case, preferably in a very short and sweet manner. Any audiovisual content relevant to the case can also be embedded. Make sure your presentation has a proper content which will be accommodative for the video and presentation things, because sometimes we may have seen that the audio and video may not play synchronously. There will be some lag, so you have to prepare all this well before, and this management and preparation starts in the earlier phase only. And usually there is a take home message for any topic you present. And my method of presenting a case report is, if at all there is an important topic of discussion, I usually add a reference citation below. Suppose this is a topic which I have mentioned and I have added an apostrophe 1, and usually I add the reference of that there and then itself. This avoids me to put a separate slide for references. But if there are multiple, then I would think of putting a separate reference slides. In the end, I would request students not to say, thank you, that is the end of my presentation, I'm open for questions. It is better you just thank the audience and the judges for listening to you patiently, and you await for any response from them. So with regards to case series, it is usually a research-based topic, and also the methods are pretty much structured. Usually you will comment in your slides regarding the backgrounds, aims and objectives, the materials and methods, what is the result of your topic, and the discussion. Use of images and graphs is encouraged. Remember, less is more. The more you keep entering the text, the more boring it gets for any person to even sit in that session and to even listen to your talk. And appropriate audio video content is of usefulness regarding the management, how you went about presenting your case, what is your outcome of your case series, and what you want to send as a message to your colleagues who are listening to you. And same reference citation can be cited in the similar slide as before. So there is a process of preparing a presentation. It usually starts from the time you receive your notification of conference and you are ready to prepare in one particular session, and then you start preparing your PPT. You are clueless how to start, how should my opening be, how should the middle part of my presentation should be, how my conclusion should be. It's all a process. It's all a learning thing. It will take some time. You may even attend some sessions where your seniors or your colleagues who have presented earlier, they may even share their presentation to you. Sometimes you may find it so interesting that you will even present the same thing. But mind you, the scientific committee is always on the lookout, and they know which topic is represented again or changed and manipulated and all those things. So my only request is, any student who is presenting, please be authentic and have your own paper which you have presented, or you want to present something which you have seen in your routine work during your day-to-day work in your residency period. Avoid copying and pasting from your seniors. Don't just go to the conference just to present for the sake of a certificate and you're trying to get qualification for your MS or MD exams. So this is something where you interact with many people and you put your points, and whatever case you have seen, it's a unique case and you have done a research study. You are coming here to put that point and what you want to add scientifically to already existing study. So this is what all the judges, even the audience, come to look out for. Every time there's a change, and a change is always a constant. So outline, when I have to speak regarding an outline, you're ready to open your PowerPoint in your laptop. You will either prepare a different color template. Now look at my template, for example. It is a very simple template, blue outline and yellow color text. And I have prepared it in 4:3. Or if you can want it to be a little widescreen, 16:9. And font size are very important. Remember, a person sitting in the back seat also should be able to see and read your text, and also should be able to, and you should be very audible enough to reach out to him. And have powerful headers. Don't add headers like introduction, uh, materials, methods. So you just put in a text like, what is so and so? How did we go about researching this topic? What were the outcomes of the study? What were the results of my study? Don't write results, conclusion, discussion. It becomes a very blunt response, and usually it puts off an audience. The amount of text, preferably the less is more concept, it should be followed. Add additional graphics, images, and deliver your presentation in a proper method. It should not be over dramatic. It should not be like too simple too. At the same time, you should connect with the audience and your judges who are sitting judging your session. Eye contact with the audience is very important. It should not be such a situation that you are simply reading what is there in your presentation or turning your back and just reading out whatever your presentation is. The body language, the stage presence is all important. Preferably coming prepared to such sessions will always do a good boost, and it will also help you to time your sessions so that you don't exceed the time. So a slide should be planned thoroughly, preferably to the point and appropriate dimension. Stick to your theme. Don't jump from one topic to other topic. It has to go smoothly, and it has to be such that the topic reaches the audience and the judges who are judging the session. And make sure that the color works in low contrast. Don't have unusual colors which are too bright and it hits the face and people have to blink their eyes multiple times and it becomes strainful. Usually I would suggest blue color with yellow color text, or preferably a white color with black. Avoid dark colors like black with white text, because sometimes it just changes, and some people who have eye strain and astigmatism may start having headaches. And there is something called as the 7:7:7 rule. So if you look at all my slides till now, I have hardly put any text which is more than 7 lines. And each line may not be having more than even 7 words. And each slide may not be having more than 7 bullet points. So this 7:7:7 rule I try to follow, because this will glue my audience to listen to me and my presentation. Anything beyond this, it's a turn off. And they try to probably see their phone, or they try to look at something, or they start discussing. You should glue your audience. The moment you start speaking, the audience should look at you. That is what a presentation should be. So more regarding slides, add appropriate images, videos, follow consistent pattern, use graphs distinctively. Unnecessary content, long paragraphs needs to be avoided. Say you're going to a presentation and your cutoff slides are 10 slides, but you have 30 slides prepared, but all the content is there, and now you are in a fix because you have a 4 minutes time plus 2 minutes question answer session. Try to remove unnecessary content, because yes, they will not be able to see them all. And moreover, you will be running out of time, which will also lead to some amount of negative markings, even though you have performed well. Remember, you're competing not only with other colleagues, but also the time. So time is important. Add additional references in Vancouver's method. Usually this is not taken seriously by students. So adding Vancouver's method shows that the student has come prepared, and the judges also will know which journal it has been taken, and they will also review it and ask questions accordingly. Each presentation should end with a take-home message. If I come to a conference, not that I come to win or present, I should share some concept of what I have done in my research topic to the audience. They should remember me for my presentation. And yes, this presenter came and he spoke about this topic, and he also gave evidence proof that this works. And this was the take-home message. and they will go back to their routine practice, and they will try this. And yes, if it works, they will give you feedback that it worked, and it will be more satisfying as a speaker. So mainly you are there to present for the audience, judges. So don't read the content blindly. Don't turn on the board. Avoid excessive use of the laser pointer. But at the same time, it's always better to see that the correct slide is portrayed and you're speaking for the correct slide. So you always have the slide transition check and use the laser pointer accordingly. Avoid overusing of the laser pointer. Avoid unnecessary flashing of the laser pointer to the roof, floor, or anywhere on the audience. It's not correct. So be audible and try to add up your sessions in such a way that the transition from one slide to another or in between sentences, if you feel that you don't know what to say, just keep numb for some time. Don't use terms like e, all those things, because that may sometimes turn off the audience. Keep silence. Maybe you can wait. Taking time is not a problem, but taking too much of time is a problem. Okay. So the common mistakes, most of the time students come unprepared. They are either nervous because they have seen a lot of students coming there and they lack confidence. And there is lack of clarity in the content because they wouldn't have prepared for this, because they would have either copy pasted from their seniors and they have come there just for a routine presentation and getaway session. And they usually have this concept of rush reading. Rush reading means they usually open the presentation, they introduce themselves, they start reading heads down. Once the session is over, they look up at the audience and they say thank you and they just leave. And if at all there any questions is asked, they usually either keep numb and they may not answer because they are not aware of the topic or they wouldn't have come prepared. So always come prepared, not only for your presentation, but also to the commonly asked questions regarding this topic. Present in your departments before coming to the conferences. Take the critical feedback from your HODs, staff, associates, colleagues, those who have attended the session. It always boosts you. And at the same time, you'll also come well prepared, well dressed, full of confidence. And then when you go there, you just have to be in a clear frame of mind that here is your topic and I have come to almost share it to everyone, and that topic should be accepted. And the best acknowledgement for any presenter is an audience acknowledging and appreciating the session. Usually they will clap, which is there for almost everyone. But I would suggest maintain proper eye contact with audience and judges. If at all you are ending the session with a thank you, don't ask questions like, may I have any questions? Are there any questions to be asked? Leave it to the judges, leave it to the audience. If at all there is anyone asking any question, they'll raise their hands. So what are the positives of presentation? Why should I present in a conference? Don't force yourself to come to a conference where you just present for a certificate and you go back to satisfy the NMC norms. You are representing your college, you are representing the pride of your department, and you're representing your research work. So you're sharing it because it is either new or it is relevant content. And this may be having innovative aspects, and there is a novelty in it. It is not copied from someone, and there is a take-home message which will help everyone to understand what exactly your presentation is about. The usual interaction regarding a Q&A session will be something relevant to your topic, and they may ask practical questions on how you handled it, how you addressed it, what were the follow-up regarding the case, and what are the critical assessment if there are any errors, or if they may even cite certain errors in the form of statistics or regarding follow-up or regarding certain points which may have been slightly mentioned wrong. Address the judges and audience in kind, be polite, and take critical feedbacks. Also share your email ID in the end so that if at all any person in the judge or the audience have any further communication, they can contact you in email. Rather than putting a thank you slide, put an email ID for any further queries and discussion. I'm free to uh, uh, get necessary feedbacks by email, and you share your email ID. So this one will be a little professional way of addressing it. So the outcome regarding this would be a good learning experience. You can get critical feedbacks. You can improve further as a speaker. Even I'm right now, I keep on improving myself further. I take feedbacks, how I could have done better. Awards, getting an award for any session is either a plus, and don't get bogged down if you don't get an award for your presentation. So getting a prize is depends on a lot of factors: your timings, your confidence, your presentation skills, your content relevance, and how different it contributed to the conference and how unique it was. And that is done by the judges. So that is not in our hands. So what you can do best is you put your presentation forward and you get in that extra confidence with every conferences you attend. And you also interact and meet like-minded colleagues, and even you meet seniors who can give you critical feedback, which will also help in your personal growth. So that's the end of my session. I would just like to share some important thing. These are some of my academic achievements, but most importantly, all these came to me because of hard work and guidance from my teachers, my professors, and my colleagues. And usually, all these awards are also an acknowledgement that you are in the right path. It doesn't mean if you don't get acknowledged, you're not in the right path, but you made an effort and sincere effort, and it was acknowledged. And moreover, the awards are just boosting confidence that you can do better, and also it will also encourage your colleagues to also get some information from those who have already achieved. And these are certain sessions where I was awarded gold medals in conferences where I presented my papers. And one of my colleague, he had attended a conference. It was his first year. He also won a gold medal, but he had made some critical errors in the presentation, but he was good enough to approach, and we sorted out well before the presentation, and he went ahead and he got a presentation medal. And it was in the PG category and mine was in the junior consultant category. He also went on to get a fellowship under Dr. Janaki Ram for 15 days. It was such a luck by chance, but he also made a desperate attempt to do well, and at the same time also present well. That confidence matters. Sometimes getting guided alone will not be enough. You have to even perform from there. So these are certain other award sessions where I was recognized for my work. And this is regarding my research topics, which were done in the national conferences. And this was in a poster presentation session in Germany, Erfurt, where I was awarded a travel grant to present my work there. So let's discuss if there are any queries. I had briefly summarized um, the entire session. If at all there is any particular thing which we want to discuss, we can have it right now. I will stop my screen share. Harsha can.
Thank you, Dinesh sir.
Yeah.
Such a wonderful session.
No,
So many things we have.
I just kept it short and
Yeah,
not too elaborate. I hope nobody got bored.
yeah. No, not at
Yeah,
all,
you have
sir.
stuck to your presentation, sir. Very short and crisp.
Short and sweet.
Yes.
Yes, sir. I welcome the seniors also, Dr. Sudarshan Reddy sir and Dr. Shashikanth sir. Dr. Dugaprasad sir is there. Sir,
Sir, even Venkatram Reddy sir is there.
welcome Venkatram Reddy sir. Please share your experiences and I request the participants to interact with the speaker now. After interaction, Dr. Venkatram Reddy sir will give tips. Later on, Dr. Shashikanth sir, Sudarshan Reddy sir will give. Shisha, you take over that.
So I request any PGs, if you want to have any doubts, you can discuss with the speaker. We'll have around 5 to 10 minutes of discussion. Before we move on to, we'll also be taking few tips from the judges. They will be speaking about their experiences, and also they'll be sharing what are their expectations from you when they give you marks. So yeah, we are open now. Any PGs, if you want to clear any doubts, you can unmute and go on, please. So Dr. Aarti Singh, you can unmute and you can directly speak.
Okay, I'll just answer the question for Aarti Singh. Uh, she has mentioned, should we put an introduction slide because we have to first tell the history and then discuss about the case. Yes, see, preferably when you present a case, it should be such that you don't want to disclose about it first in the first place. you will just tell, I'm here to present about case history of amyloblastoma of left maxillary, premaxillary area. So you've already disclosed that it is a case of amyloblastoma. So there is no fun in listening to the rest of the session because it is pretty much monotonous. And here you can just tell that I'm here to present about a patient who has come with a history of so and so left premaxillar swelling, and workup was done and all those things. Then the discussion, background, related aspect, theoretical aspect can come in the end also. Here you're presenting a case report. Mind you, what happens is they're here to listen about the case. Once the case is over, the discussion related aspects we can just summarize, because more or less it will be known to everyone. Unless and until it's a rare case which is not routine, it is very unlikely. So I would request any student who is presenting regarding their case report, they better start with a case presentation as such, as how we do in a routine case presentation in our ward or during a case presentation session in our PG presentation classes. So regarding introduction, most of my slides, if I have to tell something regarding hemangioma or something or related to any topic, I would just start with the case if it is a case report. If it is a case series, I would just generally talk what are the routine things about the prevalence, incidence, what is the description about that condition, about say if it is acute otitis, chronic otitis media, what is the prevalence of chronic otitis media, what is the incidence, and what is the presentation pattern, and then I go on to my materials and methods by aims and objectives, materials, methods. Then I will go on to results, then discussion, then conclusion. I would also request an interactive session where I want students to also come up with their own ideas, because there are different methods of presenting a presentation. It is not always one particular pattern. As long as it reaches the audience and comes with a positive response, it's good. Aarti, I hope I answered your question.
Yes, sir. Thank you, sir.
Sir, are you suggesting not to put discussion slides? Madhuri, regarding discussion slides, you can put, but it is just like a one slide or maximum 1 to 2 slides. You can put discussion slides where you describe about that particular anomaly or a pathology, whatever it is about. Yes, there is in the discussion. Yes, there are some slides for it.
So some PGs, if you want to share your presentation, you can share and show it to sir. He can give you suggestions now so that you can correct it.
Okay. And usually I would suggest students, if at all they don't mind sharing their presentation, it's okay. But if they are okay with having it projected now, I can give them critical feedbacks now itself, and maybe we can cut down on the text and also the grammar. Remember, cutting down on text doesn't mean that your grammar is thrown out of the window. It has to be grammatically, and it also has to be in proper English or the language where it is much better understood by people there. Okay, it will be in any form of presentation. It has to be almost like a precise and to the point. And you should not keep on reading. You should not be the only one talking there. And after the session ends, there should be a dual interaction. And that's when, once the audience have been satisfied and with their queries, and the judges are also satisfied with their queries, they usually award you with better marks. And most importantly, never argue in any particular session. Always agree to disagree. There's always a time where you can later on request them and you can discuss, because mind you, other of your competitors or your colleagues will be waiting in line just to get their presentations done. Respect the time and complete your presentations before time. There is always an additional marks given for that. And if you're interrupted in between your sessions, you request permission from the judges if they can answer it, or usually more or less the answers can be done at the end of the session. And suppose you have kept the presentations ready, I would not suggest you to explain more on it. The content is already there. You just read and have a one-to-one eye contact with the audience and then put your presentation, just like a news anchor, how they do it. Just like that. They don't keep reading the paper and then look up like this just to smile at the end. So you just have to interact with the audience and preferably to avoid looking less to the presentation screen which is behind you. You just look whenever there's some adjustment of the slides and things like that. If there's any queries, you can just let me know. Maybe you can take Harsha, there are any queries? I don't see anything in the chat here though.
Yes, sir. So,
Sir, good evening, sir. I would like to ask one question, sir.
Yes.
Sir, there are certain topics which are very common, but there is lots of matter to be introduced. Is it acceptable that I am not elaborating the entire topic in the introduction before I explain, sir? Can I assume that audience would be knowing it before itself
Okay. What
because
is your topic, Soumya? If you can elaborate a bit.
it is something like sinonasal malignancy or malignant otitis externa?
Okay. See, Soumya, Dr. Soumya, what I would suggest you is if you are trying to add something like an information, like a background, the backgrounds are usually to the point backgrounds. So you might tell sinonasal malignancies are so and so conditions prevalent amongst so and so group of people with a rough age group with male and female domination of so and so and predilection towards certain Asian or certain geographical group of people. And the common presentation is so and so, just like 6 bullet points. If you
Okay,
add
sir.
paragraphs, then it will become difficult for you also to read and
Yes,
catch
sir.
up with time. Okay.
So I need not elaborate all the
Yes.
rarest possible complications
Yes.
or rare
Preferably.
things.
Preferably. Add most relevant thing which is known and it is easy to understand. If at all there is any additional findings, say the rarest of symptoms which is there last, it may not be highlighted. You may even mention it when you are speaking. But remember, always you have a time attack, and the time attack has it can consistently there is usually two bells. Suppose you're mentioning presenting a case report for 4 minutes. There is a bell at 3 minutes and the second bell, which is the final bell, at 4 minutes. You have to stop before that. Not that you can extend it. There is nothing wrong in extending, but you will be paying penalty in terms of points.
Thank you, sir.
My heartfelt gratitude to Dr. Sudarshan Reddy, sir. I see him in the Namaste, sir.
Good evening, all.
Yes, sir.
Thank you, Harsha, Ramesh, for providing this interactive online session. Dinesh, I know you from your PG time. I think
Yes,
it
sir.
was earlier when I came as examiner. That
Yes, sir.
time I was, I think, first year,
Yes, sir.
and Rohit was second year, and you were final year.
Yes, sir.
You have explained in detail the presentation, the everything. By experience only, we get after so many years. But now what we are doing, whatever we gained, we are telling the PGs in the first year, second year itself, so that
Yes, sir.
they excel. So they need not uh, take more time to get experience. So we are making them experienced with our experience. So if they are interested, they can become superior to us. I see many PGs doing better than me. So with lot of difficulty, I could reach to this level, and I am very happy when my first year, second year, third year PG or SR presents better than me. I appreciate a lot, and I want everybody to do better than the teacher. Thank you.
Thank you, sir.
sir, I request Dr. Venkatram Reddy, sir, to speak a few words, sir, and share his experiences and his expectations uh, from what he expects when he awards marks for the PGs.
Hello,
Sir,
am I
good evening.
audible?
Yes,
Am
sir.
I audible?
Yes, sir.
Am I audible?
Yes, sir, you're audible, sir.
I think excellent, Dr. Dinesh. I appreciate you a lot. I
Thank
think
you,
you
sir.
have almost all the points. I had several things in my mind, but you have almost covered it. And
Thank you,
every,
sir.
I think they have taken it right in their brain. And certainly all the points have been covered. I just put forth only very few things which probably you have already covered. Number one is the time management. Time management is utmost important. You are given 5 minutes means you are able to finish within 4 minutes. If anything goes wrong, fumbling. Number two is even if it is a routine case, the people are afraid. It's a routine case. What is there new in that? So thing is, you have to convey properly what you want to actually convey in your case report or a case series. And most of the PGs, I have evaluated many on the online last year, for last year also. They just read the slide from A to Z in a particular slide. That should be avoided. So you just highlight what you are supposed to tell in a full slide of a full matter. So they just read like a textbook. So that doesn't carry any impression. See, when the slide is being flashed, you have to highlight only one or two things. Rest will be taken care and understood and perceived by the audience and also judges. So you don't have to read like a textbook. So that's what they do. So time management, do not read any slide from A to Z. If you have all the investigations, you must impress on the investigation, what is being seen. And suppose if we, even if it is a routine case, suppose it's a case of inverted papilloma. What is there inverted papilloma? You have to highlight what is being conveyed in that particular case. Anything is different. It may be routine case, but the presentation may be different. So you have to highlight on certain points. Then again, I think rest all good. I think nowadays the PGs are presenting very impressively. When bygone those days, when we were postgraduates, so we used to practice a lot for presentation, but not this generation PGs. This generation PGs are very good in presentation, except the English literature and all those things. So we were not that, but they were not able to pursue certain things, which certain that Dinesh has given everything crystal clear. So time management is utmost, but do not read the slide and convey the message. See the summary and the message, the conclusion slide, it has to contain everything. The conclusion slide is the most important thing. What you want to convey, what you want to conclude it. So that actually gives the last slide, last before slide. That's very important. So avoid thank you, all those things. As he said, give your details, your institution details, and your email ID. So now, as per rules, the institution details also should not be provided because there may be some partiality. So at least your mobile number, email ID can be provided for future communications. I think that's all I want to convey.
Thank you, sir, Venkatramreddy sir, for sharing your insights. Now I request Dr. Shashikanth sir to speak a few words.
Yeah, Ramesh, thank you. I was interested when I saw your topic. I was surprised. I gave this talk to my PGs and junior postgraduates in our hospital regarding how to give a talk. I had like 6 different slides. I can show you a couple of slides for that if I can share you my screen.
Please, sir.
Important tips for the PGs, and most of it was covered by my previous speaker, and he did an excellent job. So I won't go through most of the cells, but I'll go through one or couple of. How can I share my screen? I'll go through the this thing. A couple of things that I wanted to tell as a communication. I don't know if are you able to see my screen?
Yes, sir.
Yeah, it's a Mac. So I say same structure. I think my previous speaker has highlighted most of the points excellently, so I won't go through those points. I want to give little bit of communication skill guidance, and this is not for presenting in the conference, and this is for presentations in general. Even when you are presenting in the department, even when you are presenting as a guest lecturer, anything this has to be followed. Again, Dr. Venkatramreddy has again excellently explained, and previous speaker has never ever read the slides. This is what I told my junior PGs. And most of even someday to some degree, some consultants or read from the slides. I did not come here for reading the slides. I have come here for the gist of the knowledge. And for that, it is very, very, very important not to read the slides. And you look at the audience and talk. Don't look at your screen and talk. It just makes it boring. And another point is, if I keep talking in the same pitch, suppose if I keep reading, the inverted papilloma is a disease where you can find, if I keep reading in the same pitch, same tone and temper, audience will lose interest. The most important factor while you're presenting is vary your pitch, tone, tempo, scale. Okay. And always when you're trying to explain, give relevant similes and examples. That's very important. Okay. If you don't know something, don't worry. Nobody knows everything. Nobody on earth knows everything. Just admit it and move on. And if possible, while presenting in a department, not during an academic competition, but in departments or when you're guest lecture, try to include some jokes or something. And audience interaction is key, especially when you're presenting in your department. You want to interact with the audience. Interacting with the audience will always engage them. Okay, and ask them. You can ask them a question, ask them to raise the hands. Finally, ask them audience their input. Always talk to the audience. Just don't keep anything to yourself. Again, this also has been explained by speaker. I won't go through it. It is the same principle. Again, no more than 10 slides. Do not include, he said 7, but I would put it 6. That is, but anyway, not more than 6 or 7. Do not, again, as somebody said, if you can't write your message in a simple sentence, you cannot say it in an hour. Remember that. That's the key point there. And this has been explained. More pictures than slides, more videos, and do not put, one thing I have seen from PGs and junior people is putting slides like this. I mean, I can't read like that. I have no time nor the patience. That is why I have come here to listen to your talk, to give me the gist. Instead of this slide explaining the big Dick Halpex manure, if you put this slide and give me 3 or 4 sentences, that's more than enough. Okay. So we remember what 10% of what we speak. This is an important thing. And couple of things I will tell you. This is the most important thing ever. Less than 20% of the people will remember 20% of what you have said, 20 minutes of your talk. So make sure that what they remember is of vital importance to them. Okay. And another thing that is for PGs while presenting in the academic competitions, the success of your presentation will not be judged by the knowledge you send, but by what the listener pursues. This is the most important thing. It is not what you are intending to send, it is what the listener intends to listen. And while giving, this is another most important thing I have given while giving guest lectures and everything. Make sure that you have finished speaking before your audience have stopped listening. That is very important. So their attention span is limited. Make sure you have conveyed your point before they switch off their mind. So these are the 5-6 points I gave this talk last week. So it was a very opportune time for me again to pull back the slides. Ramesh, that's all I wanted to convey. And these are very important communication tips. And I think other previous speaker has also excellently put this. But it is very important for the be confident, make an eye contact, do not read from the slides, admit if you do not know, nobody knows everything, and maintain a proper structure of your presentation and have little bit command on the English. You don't want to use a bad grammar which upsets some of the listeners. Okay, you not use sophisticated language. You need not show your proficiency in English, but just don't commit basic language grammar mistakes. That's all. Okay, Ramesh, that's all I wanted. I had just had.
Thank you,
Thank you,
sir.
sir.
Thanks.
I
Thank
just
you,
gave
sir.
this talk a few days back. That's why I had. How do I disconnect from sharing? Yeah, can you take it off?
I'll do that. Take
Yeah,
it.
You
just
can leave, sir. No problem. Thank you so much, sir.
yeah.
Ramesh,
Sir, good evening, sir. Welcome,
just,
sir.
just one last word. What following Dr. Shashikanth? See,
Sir, sir.
however good you have prepared the presentation, however the best series you have made it, or case report you have made it. I think the word which is Dr. Shashikanth said, what the judges perceive is more important than your paper. The content of your paper may be very high, but your presentation matters, and the judges' ears have to take in a proper direction. See, there are 3 judges, single judge, 3 judges. See, you should not lose any heart. Why I didn't even get the second prize also. So don't take that way. Your presentation in the conference is very important, not getting a medal or a second prize. So that's the bottom line for all the postgraduates. Never lose your heart, and you may feel yourself that I have done exceedingly well. But how the judges perceive your paper is very important, because at that particular point of time, within 5 minutes or within 7 minutes, how they perceive, how they draw a conclusion is more important than your excellent preparation of the paper. So presentation is more important than winning a medal. That's the bottom line.
థ్యాంక్ యూ సార్. శ్రీహర్ష, ఇంకా మన పెద్దవాళ్ళు ఎవరైనా ఉన్నారా?
Sir, and I think that's all, sir.
Yes.
So
బిఫోర్ కంక్లూడింగ్, శ్రీహర్ష, రిక్వెస్ట్ వన్స్ అగైన్ వర్చువల్ గా ఏమేమైతే గైడ్ లైన్స్ ఉన్నాయో, అంటే నాట్ మెడల్ సంబంధించినవి కాకుండా జస్ట్ వర్చువల్ ప్లాట్ఫామ్ లో ఎలాంటి జాగ్రత్తలు తీసుకోవాలి అని ఇప్పుడే చెప్పేసాయి. మళ్ళీ రేపు ఎల్లుండి కూడా సేమ్ టైం వి విల్ జాయిన్ and correct the presentations. Okay.
So yeah,
the virtual presentation, I mean, not the content.
Yeah, I'll be speaking few lines regarding the general settings for your systems.
Yes, technical aspect. Okay.
Technical aspects. One small suggestion is, if suppose there are 4 or 5 PGs from the same medical college, what you can do is you can use a single system, which is preferably a latest system. So you can, mostly your colleges and libraries have a very good internet connection, where you can find a nice room which is silent and has a very good internet connection. You can preferably all sit together at one place, and you can use the same system rather than using 5-6 systems. So this basically avoids the time wastage between every consecutive presentations. And second thing, preferably place your position in a well-lit area. The judges would always like to see you. And last time we have seen a lot of PGs were presenting with their videos turned off. So that is actually not a good sign in the virtual series. So always sit in a comfortable place where you are well visible to the judges and all audience, and make sure there is no background noise or disturbance. Some people might put on a table fan close by, which causes lots of noise and all. And so apart from this, I think most of you are little acquainted with this Cisco WebEx. We have been doing a lot of presentations in these apps. We will be helping you out for the next 1 or 2 days. Tomorrow and day after tomorrow also, we'll be opening up the session where you can just test your audio, visuals, your presentations. And if at all if you face any difficulties, I'm here to help you out. And so I request everyone to basically just come and check, so that you don't you'll be anyway nervous on the day of presentation, and this will not spoil your mood if something is not working at that time. Okay, so that's all, sir, from my side.
Harsha, I'll just add one point. Especially due to COVID, all these online presentations have increased. And each student will be given a designated time slot where they have to log in well before. And usually an admin will be coordinating their activities.
Yeah.
They will probably tell you to mute in most of the session, and usually that will be taken care by the admin.
They're doing that, sir.
As a student, when I present my presentation, earlier they were requesting for a recorded session, and that recorded session will be continued. And after that, the student will come online, and if at all there is any query, it will be addressed. But now sometimes they may even ask to present it live. When you're presenting it live, not only you will have the pressure of your time attack, you'll also be little worried whether your presentation slide transition will be appropriate, whether the images which have any kind of adequate video quality, whether the video will start on time, that issues and stress also will be there. So practice well beforehand, and if at all there is any animations done, does it increase and decrease the transition slowly, and all these issues has to be sorted out. And your voice quality should also be appropriate. Sometimes students put their mic very far and they are not able to hear. So first they should check whether that they are audible, and first confirm it and then proceed. Have an adequate eye contact with the camera, and talk to the camera as though the examiner or the audience is in front of you. So that way you will also connect. And when you are talking online, whatever content is there in your presentation is right in front of you, flashing you. So, but you know what it is, at the same time, you're also speaking to the camera. Speak whatever it is to the point, whatever content is there. Don't explain those points. Suppose the CSOM prevalence is in low socioeconomic status in certain areas, and that, no, just mention low socioeconomic status, go to the next line and avoid further briefing on it. You save up on time. So that way you can go to the next slide, and don't be in a rush that you have to catch the next train or the next bus to your house or something like that. Be in a comfortable pose, and just avoid any form of additional noise or some, keep your phone in silent mute, and and finish your session, and then wish them thank you for listening, and then get done with your presentation. Okay. I think, Sir Ramesh sir, Ante Ankonta,
Sir,
is there
yes, sir.
anything?
Yes, sir. Very elaborative session, sir. Very useful to
I
our.
would like to thank Harsha. I've always told him that I would not be available for any sessions because all this is, it will be time consuming. But today he just informed me uh, earlier. He had informed earlier, but he told, sir, today the session is there. You better be
Yes, sir.
ready.
That's a miscommunication.
No, no, it's not. It's okay. He's my friend. It's okay. For him, I should be ready anytime. So I just, in a matter of 1 hour, I concised everything and kept it small. If you
Ramesh,
want, Harsha, I've already sent you that copy
Yes,
of
I'll share
this
it.
presentation. Even the abstract copy also, I will send it to you. You can hand over to the students who are interested. They can collect it from Harsha, how to write an abstract, and they can take the outline of my presentation. That presentation will have the content. I have removed all that achievements wala photo aside. I don't want to portray that. That I've additionally added just to show that if you do your work properly, it will be awarded. And never ever get sad because you were not awarded for your talk. It has happened to me many times, but I have also seen success and failure both the sides. And I always take the feedbacks from my teacher, how better I can do, and their words are more important to me. And even the teachers who are in my own, from the examiner's point of view, they also come and given me feedbacks. Okay, sometimes I've got too many feedbacks, like, you already won many awards, now you give chance to someone else. Those feedbacks also have got. So take it positively. There is nothing wrong as long as an audience in the crowd gets your point and a take home message. That is more worth, that is the real gold medal than any of the other things. Okay, don't get disheartened. Remember, there are 100 students participating and there is only one prize. So don't make a desperate attempt to show that. The prize will eventually come to you if everything goes well. As one of the teachers correctly mentioned, the judge's perception of your talk, how your attitude, how your method of presenting, how it has impacted them, and how it has connected them, that matters. It's just like telling a story, and that story connected them, and they found it very impressive, and they gave the prize. Okay, so don't go behind any false informations or rumors. This also happens many times. I have seen, as a student, I have seen they have prioritized this. Just leave that alone. If your topic is good and it was acknowledged, very well. Go home with a smiling face.
Thank you,
Yes,
sir.
sir.
Ramesh,
Yes, sir. Sir.
I would like to wish all the PGs good luck. See, if you are prepared well in your topic, you will definitely well. See, there is a famous statement from Steve Jobs. I don't know if PGs knows. He said, "People who know what they are talking about do not need PowerPoints." So, if you are really good in your subject and you know what you are talking, you can give your presentation even without PowerPoint. See, that is the very important. I advise PGs and all through go through the body language and the mannerism and tones. If you want to learn, you can see old Steve Jobs keynotes while he was presenting new Apple products. You will learn a lot from him, like his body language, how he creates interest in the audience. So I think if you are prepared, you will do well. I wish all the PGs good luck, and I'm pretty sure you guys will do well. Thank you, Ramesh.
Thank you, sir.
All the best to the PGs. Do well.
Thank you, sir. All are the winners. All participation itself is the winning stone, sir. Sir, every time we are telling that more than 100 students are presenting means that itself is the worthy thing. So presentation is most important rather than winning the prize. Anyway, we are every time encouraging more than 2 or 3 people for second prize also. And once again, my special thanks to Dr. Dinesh sir and Dr. Sudarshan Reddy sir, Shashikanth sir, Venkatram Reddy sir, all the seniors who have advised now, and also most important, the participant postgraduates. Thank you for attending and all the best. Thank you, Sriharsha, once again.
Bye.
Thank you, sir. Thank you, sir.
Yeah, you can end the session now.
Okay.
Thank you, one and all. Thank you.
Thank you, sir. Thank you, Dinesh, sir.